So let me show you the interpretation. Now, for example, over here, the agglutination was just seen with anti-A. So the blood group will become A. Okay. So over here, the agglutination was seen just with B. So it is called as blood group B. Over here, agglutination was present in both A as well as B. So you will see AB. Whereas over here, neither here agglutination was there. So the blood group will become O. Always remember one important aspect: whenever agglutination occurs, the color of this entire sample will become that of that group. It will become bluish. Over here also it will show yellowish. Okay, just remember this aspect. So now if you have understood this slide method, tell me what is this blood group that we have. What is very important, especially for the postgraduate students, this gel or column agglutination technology. Very, very important short note that is asked. And in all big colleges, this is the technology that is being used in blood banks. It is not from today. It is from the past 5 to 7 years they are using this gel and column technology. So first, let me show you what is this. So basically a card is available. Can you see this card, everyone? This is called as the gel card, which is available. And today, maximum blood grouping in the big hospitals, they're carrying out by this gel card technology. So over here, we are having 6 microtubes, as you can see, 1, 2, 3, 4, 5, 6. There are actually 6. Over here, you can see there is 6 tubes. Okay, over here, they have shown 5, but there are 6 tubes. And this tube, it is containing a gel, which is a medium that is made up of dextran acrylamide gel is present over here. Now, this gel is actually acting as a reaction medium where the reaction will take place. Plus also as a size filter, it is acting as a size filter. Means different size particles are going to accumulate at different levels. So see over here, particles accumulated at this level, particles accumulated at this level, particle accumulated at this level, particle accumulated at this level. Okay, so over here, what we are doing, this gel is containing this gel, that is acrylamide gel is there. Along with that, the anti-sera is there. This is provided by the company. This is provided by the company. Now to this, we are adding the patient's RBC. Patient's RBC are added over here. Now, for example, if agglutination is occurring at the top, okay, if it is occurring at the top, it is taken to be as positive. And if agglutination is taking place at the bottom like this, it is said to be negative. Now, from here, there's a different gradation. Now, for example, some of went little bit up. It is also positive, but it is 1 plus positive. Some of this went little bit more up. It is 2 plus positive. Some of them stayed here. It is 3 plus positive. Some of them stayed at complete top. That is 4 plus positive. So today we are going to start a very important topic. Today we are going to read about the blood banking. And today we will start with the blood group systems and the grouping method. So basically today we are going to understand what are the major blood group systems, what are the blood group antigens, and what are the antibodies which are there in the system, what are the clinical importance of this system. And we are also going to discuss in details about the grouping methods and also the problems that we face on a day-to-day basis with regards to blood grouping. So let us start today's topic of discussion. So as I told you, there are different types of blood group systems which are in place today. And most of these blood group systems or the blood groups, they are inherited in a Mendelian fashion. Okay. But remember that the blood group system, it is codominant in nature. What is the meaning of codominant? That, for example, if AO is present, okay, in that situation, the dominant, that is A, will be choiced. If BO is present, in that case, B becomes dominant and B will be choiced. If AB is present, then both of them will be choiced. Okay, so that means there is a codominant pattern of inheritance that is seen. So the most important blood group systems that we have seen, one is your ABO blood group system that we know, and the other is the RH blood group system. Now, why is it that only these two blood group systems became very important? Yes, anyone has any idea why we are reading just about the ABO and the RH group system? Yes, because these blood group systems, they have discovered certain antigens like the A antigen, B antigen, RHD antigen, even the H antigen. So all these antigens, mostly they are immunogenic in nature. The AB antigen and the RHD antigen, they are immunogenic in nature and they can cause transfusion reactions. Because of this reason, we are studying the ABO and the RH blood group system. Often very important question which is asked you all that what are the other blood group systems which are in place apart from ABO and RH. So you should remember these names at least, okay, like MNS system, Kell, Duffy, Lutheran, Kidd, and Lewis. Okay, so without wasting any time, we are now going to start with the ABO blood group system. So as we understand, in this ABO system, okay, we are having four important groups. One is the A, AB, AB, and O. So probably most of you know about this. Okay, so this ABO system, it was the first blood group system to be described, and it is also the most important, blood group to be considered in a case of blood transfusion. Not only the ABO system, but also the RH system is important when we are considering blood transfusion. Okay. So very important with regards to the ABO blood grouping, there is a law that is called as a Landsteiner law. Okay. Now this Landsteiner law has been specifically designed and laid down for ABO blood group system. Okay. So what does this law state? This law states that anti-A and anti-B antibodies, they are always present in the plasma of individuals lacking the corresponding antigen in the RBCs. So let me just show you one diagram so that I make you understand the system of antigens. So over here, if this is the RBC that we are looking at, okay, this is the RBC. All the antigens are present on the surface of the RBC. So for example, the H antigen, okay, or for example, the D antigen, or the A antigen, or the B antigen. All antigens are present in the RBC surface. Whereas the corresponding antibodies, always remember one important factor, that antigens, they are always present on the cell surface, okay, RBC surface. Whereas the antibodies, they are always present in the serum. Antibodies are always present in the serum. So what I want to tell you over here, that whenever I am talking about a cell or RBC, then whenever I'm speaking about antigen, that means I'm talking about RBC surface containing the antigen or a cell containing the particular antigen. Whenever I am talking about serum, or whenever I'm using the term sera, always remember that I am speaking about the antibodies which are present in the sera. So when I say anti-sera, that means I am talking about antibodies which are present in the corresponding sera. So according to the Landsteiner law, so what does the Landsteiner law tells us? So let us try to understand what Landsteiner law is trying to tell us. So the Landsteiner law, it is telling us, so if for example, this is an RBC, okay, this is a RBC. And if for example, the surface of RBC is containing an antigen that is called as an A antigen. So what is going to happen? Okay, it states that only those antibody, so in the serum, if you see, only those antibodies will be present for who the corresponding antigen is absent. So over here, according to this law, which antibody should be present? Yes, tell me. Which antibody should be present in the serum over here in this case? According to this law, the corresponding antibody should not be present. So antibody B will be present in a person whose RBC surface is having A antigen. Is this very clear? So whichever antigen is present, okay, remember the corresponding antibody has to be absent or vice versa. Okay, just remember this. This is called as the Landsteiner's law. This is called as Landsteiner's law. So for example, if I'm taking the blood group A, okay, so when I'm saying individual is having a blood group A, that means there is some antigen which is present on the surface of the RBC. So that is the cell. And what is this antigen? That is the A antigen. Okay, so one very important thing is that which antibody will be present in the plasma. So this over here has been written by mistake. It will be anti-B will be present in the plasma. Okay, and over here by mistake it should be anti-A should be present in the plasma. So an individual who is having anti-A will be having anti-B present in the plasma, whereas an individual who is having B antigen on the RBC surface will be having anti-A in the corresponding plasma. Now, similarly, if the RBC surface, for example, is having A and B antigen, both the antigens are present on the RBC surface. So they are not going to have any corresponding antibody. So no antibody will be present in the serum or in the plasma. Very, very important point. Okay. And lastly, for example, if no antigens are present on the RBC surface, then correspondingly, if you see in the plasma, both the antibodies will be present. So that becomes very, very important. Okay. So in individuals who are having group A individuals, they are basically having anti-B in their plasma. Group B individuals are having anti-A in their plasma. Now, those individuals who are having AB blood group, they are having no antibodies in the plasma. And those who do not have any antigens on the cell surface, they have anti-A or anti-B. Okay. So this is called as the Landstein's law, which is mostly applicable for basically our ABO blood group system. So as I told you, blood group A individual is going to have group A antigen on the RBC surface. Blood group B is going to have B antigen on the RBC surface. AB individuals are going to have both A and B antigen on the RBC surface, whereas the group O individual, they are going to have no antigen on the RBC surface. Okay. Is this very clear to everyone? Landstein's law. So if you do not understand this, then it will become very difficult to understand the further aspects. Okay. Always remember, when I am telling about an antigen, I am speaking about antigen present on the RBC surface. When I am talking about antibody, I am talking about the antibody present in the serum or the sera or the plasma. Okay. Now, the most common blood group in the ABO system, if you see, it is the O blood group. And the least common out of these, it is the AB group. Okay. Now, remember, in the newborns, when a baby is born, this ABO antigen system, that is the A and B antigen, this is very weak. Okay. So full expression of these A and B antigen, just like in adults, okay, it takes approximately 2 to 4 years time. It is going to take approximately 2 to 4 years of time for full expression of these antigen. So we are going to individually see these blood groups. So the blood group O individual, so you tell me which antigen will be present on the RBC surface in blood group O. There is no A, there is no B antigen. So the only antigen which is present over here is the H antigen which is present. Is it very clear to everyone? It is the H antigen. Now, what is this H antigen? I will discuss in details. But over here, there is no A, no B. The genotype, remember, the genotype of these individuals is OO. Okay. And these individuals only have an increased amount of a antigen that is called as an H antigen. Only the H antigen is present on the surface of these individuals. Now, the antibodies which will be present in the plasma in the sera will be both anti-A, anti-B, as well as anti-AB. Okay. And what is the nature of this antigen which is present? This becomes very important. The nature of this antibody in the plasma that we see in group O individuals is of IgG class. So the importance of this IgG class is that it can cross the placenta and cause hemolytic disease of the newborn. So this kind of hemolytic disease of the newborn, what is it also called as? I have already taught about this in hemolytic anemia. It is called as ABO hemolytic disease of newborn, because over here we are just considering the ABO blood group system. Always remember this fact. Okay, so you will be telling me that, sir, if a boy is AB is if for example the mother is O positive and the child is A positive, for example, in that case, then why doesn't the antibodies in the mother go and cross and they kill the RBCs of the child? The reason over here, okay, just remember what I am trying to say. If the mother is O and if the child is basically A, okay, leave the status of RH, maybe okay, both of them are positive, so there is no problem with the RH status. So if the mother is also O positive, the child is A positive, then the antibodies from here should cross and kill the RBCs. But this reaction is very minute and it is not of any clinical significance. So that is why ABO hemolytic disease of the newborn is not that much serious. Okay. Is this very clear to everyone? This concept is very clear. Okay. Now let us go to the next blood group. The next blood group is blood group A. So this is the RBC. So they are having H antigen. H antigen is present. It is the base antigen which is present in the O blood group individual also. Along with that, in addition, they are having A antigen as well. So over here, the antigens that are present on the RBC surface is A as well as H. Okay, and the genotype can be AA as well as AO. Both the genotypes can be possible. Now, this A antigen are of two types. Because of that, we are having two different blood groups. You can have A1 as well as A2. So 80% or predominantly all of us who are having A group are predominantly having A1 blood group, whereas some of us, we have A2 blood group. Now comes the very big difference. The antibody, if you see over here in the plasma of patients in the group A individual, is containing anti-B. And the nature of this antibody, if you see, is IgM. It is not IgG. It is IgM. Always remember, this is IgM. IgM cannot cross the placenta. Remember this. IgM cannot cross the placenta. Okay, just remember. Now the blood group B antigen, again, it becomes very simple. The RBC surface over here, H will be there. Along with that, there is a B antigen. So the total antigen is B plus H, and the genotype of this individual is BB or it is BO. Again, the corresponding antibody, according to Lansdowne law, cannot be anti-B. It will be anti-A. And the nature of this antibody is IgM type. Okay. Now, the last group under the ABO system, if we see, it is the AB blood group. Now, over here, in addition to H, they are having the B as well as they are having A. Okay. So they are having all the three antigens. So the genotype over here is AB. So they are co-dominant over here. They are co-dominant, and antibodies are not present. No antibody will be present over here. Now, because the A blood group can be A1 and A2 type, so AB can be as A1B as well as A2B. Okay. Is this very clear to everyone? Any doubts with regard to the blood group, the location of the antigen, the location of the antibody, about the Lansdowne law, genotype, and the nature of antibody? Is it very clear to everyone? Any doubts anyone is having? Any doubts?
No, sir.
Okay. I'm going very slowly because it is going to become little bit difficult as we move ahead. Okay. Now the antigens of the ABO system, remember, mostly these antigens that we are reading about, they are present on the surface of the RBCs, and they are strongly present mainly. So whenever I'm speaking about the antigens, I told you that antigens mean they should be present on the surface of the cell. Now that cell, in most cases, we are having RBC, but they are also present on the surface of WBC, platelets, and in case of body tissues. Okay. So these are all solid substances where they are also present. Now it is because that they are present in the body tissues that they can cause rejection of the solid organ transplant also. That is why they become clinically important. And there is a weak presentation of these antigens on the surface of the WBC and the platelet. Now, very importantly, this presence of the ABO, okay, might also be present in the body fluid except the CSF. Leaving the CSF, they are present, they can be present in other body fluids, but it is plus minus. So those individuals whose antigens are present in the body fluids, they are called as secretors. And this depends on the inheritance of a gene called as SE gene. So individuals who are having this SE gene, they are also secreting their antigen. So for example, it is a group A individual. So that person is going to secrete the antigen in the body fluids also, like in the semen, in the saliva, like this. Okay. What is the importance of these secretors? I'm going to tell you in the later part of the video. So now I'm going to tell you that how this particular this thing is coming, means how this particular antigen is being formed, how this antigen forms. So firstly, we see that there is a gene called as the H gene. And this H gene, it is encoding an enzyme called as a transferase. It is usually just a transferase enzyme, a specific transferase encoded by the H gene. What this transferase does, it is acting on a precursor substance which is present on the surface of the RBC, and it adds a particular glucose, a particular carbohydrate molecule called as fucose, and then converts this precursor substance into what is called as the H substance, which is nothing but it is the H antigen that we had seen on the surface of the RBC. Yes, very clear to everyone. Now this H substance that is there, now this H substance is now present on the surface of the RBC. Now, depending on whether the person is having the A or he is having the B gene, that person is going to encode another specific transferase enzyme, which is going to act on the H substance. And depending on whether the transferase is encoded by A gene or B gene, if, for example, the transferase is encoded by the A gene, then in that case, it is going to add a sugar molecule that is N-acetyl galactosamine, and that H antigen is now going to convert into A antigen. And then the blood group of that individual will become O. So he will contain both the H antigen as well as the A antigen. Is this very clear? Similarly, individuals who are having the genes for the B blood group might secrete a transferase which might act on the H substance and convert them okay, into the B antigen. How? By addition of galactose, by addition of the sugar galactose. So this is the only difference. If you add N-acetyl galactosamine, you will to the H substance, you will get A antigen. If you add D-galactose, you are going to get the B antigen. Okay. Now
So
this
please
A,
repeat this once.
I will repeat 1 second. Okay. This A and B gene that you see, it is present in the chromosome number 9. Okay. This is how we are acquiring this antigen. I will repeat once more. Do not, don't get worried. It's very easy. See, as I told you, everything is starting from the H gene. The H gene is encoding a specific transferase, which is converting a precursor substance, which is present on the surface of the RBC, into an H substance. Okay, it converts it into an H substance. And what does this transferase do? It is adding fucose molecule to the precursor substance, and that addition converts the precursor into H substance. Okay, now once this H substance is formed on the surface of the RBC, now accordingly, if for example any A or B gene, if it is present, for example if the A gene is present, okay, then that A gene is going to encode a particular transferase which is converting the H substance into A antigen. How? By addition of N-acetyl galactosamine. So addition of N-acetyl galactosamine will convert the H substance into the A antigen, and then the individual will be said to have blood group A. Similarly, if instead of A gene, the individual had the B gene, in that situation, it is going to encode a transferase which will convert the H substance into the B antigen by addition of galactose molecule. So in that case, the individual will have B blood group. But for example, the person is having both A and B gene. In that, he will form both the A antigen and the B antigen, and then the person will said to have AB blood group. Is this very clear to everyone? Now, what happens in individuals who are of O blood group? Or for example, they have O gene, they do not have A, they do not have B. What happens? Individuals who have an O gene, they produce a transferase which is inactive, and that transferase cannot convert the H substance. Understand? So that is the reason individual with an O blood group, they are just having the H substance. Okay, they just have the H substance, they do not have any other antigen. Is this very crystal clear that how this antigen is coming on the surface of the RBC? Yes, very easy, not that much difficult. I hope I have made this very easy for everyone. Can we move ahead? Okay. Now comes a very important concept, that is the concept of Bombay blood group. So over here, there is an RBC. Usually we see that if the person is of an O blood group, then he will just have an H. So in all these blood groups that we are reading, the minimum amount of antigen that an RBC has, that is the H antigen. Yes, we understand this fact. Even the O blood group individual, they have the H antigen, but they don't have A and B. Okay. But some people, they fail to produce this H gene. This H gene that we have read over here, this H gene, this is not present in some individuals. Remember, in individuals with O gene, okay, they have the H gene, but they do not have any A or B. So only H is produced. But individuals who do not have the H gene, they will not be able to convert the precursor into the H substance. And as a result, these individuals do not have any kind of H substance. So there is no A or B antigen generation whatsoever. So as a result, these individuals will not have any H antigen. So what is the downside of this? Okay, so there is no H substance. There will be no A or B generation also. Even if the individual, okay, they are having the A or B gene, this Bombay blood group individual, even if he is having A or B, he cannot produce the A or B antigen. Why? Because the H substance is not available. Okay, such individuals are said to have what is called as the Bombay blood group. It is having Bombay blood group. Now, one very important fact is because the H is not there. So this individual, okay, as I told you, according to Lansdowne law, he will not have, if they do not have the corresponding antigen, then only the antibody will be there. So A antigen is not there, so anti-A will be there. B antigen is not there, so anti-B will be there. H antigen is not there. So what is going to happen? Anti-H will be there. Remember, none of us who are having the normal ABO system, none of us have this anti-H. Just imagine, because all of us, we have minimum of H antigen, so we do not carry anti-H at all. So what happens that these individuals, they have anti-H. So any kind of, blood sample, if you are going to give, you give them A, B, AB or O, any of them, they are going to cause transfusion reaction. Why? Because this anti-H is going to bind with the H antigen present in all the other blood groups. Understand? So what are you going to do? What will happen to this individual? Yes, how he is going to survive? So this is a Bombay blood group. Why it is called as a Bombay blood group? Because it is first discovered in an individual from Bombay. So because of that, it is called as a Bombay blood group. It is extremely rare and it is having no antigen, including H is absent. Remember, that is the difference. Individuals with O blood group, they do not have AB, but they have H antigen. Remember, they have H antigen. So we all know that O blood group O is considered as a universal donor. Okay. But one very important aspect is these individuals with Bombay blood group, they cannot accept O group as well, because the O group also has H antigen and this Bombay blood group individual is having anti-H. So there will be a transfusion reaction over here. So remember, these people are having anti-H. They are strongly immunogenic in nature. Okay. So blood group O, remember, when if you do the grouping of this individual, it will come out to be blood group O. Why? Because it will not give any reaction with your O antigen. It will not give any reaction with the B. So it is coming out as O only. But if you are going to do the cross matching of these individuals, all units, whether you give A, B, AB or O, all units are incompatible. Even the O blood group are incompatible with Bombay blood group. So these individuals can just accept their own blood. Okay, so what they can do is they can donate their own blood into the blood banks, okay, for their future use. This is what they can do. Is the concept of Bombay blood group crystal clear to everyone? Any doubts with regard to Bombay blood group anyone is having? Yes, is a very, very important concept. Very, very important concept. Very commonly asked question and very commonly asked short note and Viva question also. Any doubt with regard to Bombay blood group?
Sir, while the grouping will come as O in case of Bombay blood group.
Yes, it will come out as O if you do the slide test over here. Okay, so if you add anti-A over here, okay, so anti-A over here, if we are adding, so will there be any agglutination? There will be no agglutination. If you add anti-B, will there be any agglutination? No, because it is not having any antigen on the surface. So these individuals, they do not have A or B antigen on the surface. So how will they give any kind? It will be grouped as O only. Because what is definition of O? Absence of A and B is the definition of O. Yes or no? So basically they will also give O only, because by definition they are fulfilling that. The only difference between Bombay blood group and the O blood group is that the Bombay blood group, they contain anti-H because they show absence of H antigen, whereas the O blood group, they show presence of H antigen, but there is no presence of anti-H in O. This is the only difference. Is this crystal clear to everyone? Now it is clear? Okay.
Yes, sir.
As I told you that there are certain times, there are certain secretors versus non-secretors. So secretors occurs because due to the presence of a gene, that is a dominant gene called as SE gene, which is present in chromosome number 19. At this point of time, if I ask you, where is the A or B gene present? Will you be able to recall?
Chromosome 9.
Very good. Very good. This is a very important question which is asked to everyone. Okay. Now, what is the use? This secretor, non-secretor, why we want to do blood grouping from a saliva sample or from a semen sample? Why? In case of discrepancy, for example, in blood, you are getting one group, in forward or reverse grouping, you're getting some discrepancy. To solve out the discrepancy, you take the other sample and then you do. One other important thing is that it has a medico-legal value in forensic studies. Why? So for example, if there is a rape accused, a person is accused of conducting the rape. So for example, there is a semen sample that you can collect from the area, and you can see the group in the semen sample versus the group of the blood of the rape accused. So if there is any discrepancy, that means the person is not an accused. The accused is not a rape accused. Okay, so for these studies we are doing secretor versus non-secretor studies is done there, and the test that we do for this is called as inhibitor test, is done on the body fluids for blood grouping. Now we have spoken about the antigens, we will speak about the antibodies of the blood group system. Now this anti-A and anti-B, they are naturally occurring antibody. Okay, they are there from the beginning. Okay, remember, but they are not present in case of newborns. Why? Because their immune system is underdeveloped. It takes approximately 3 to 6 months of time to develop these antibodies. Okay, so that is why we forward grouping is possible in case of newborn, but reverse grouping is not possible in newborn. Just remember this fact. What is basically your that it takes 3 to 6 months of time to develop antibodies in the newborn. Okay, later on I will tell you what is forward grouping, what is reverse grouping. Now remember, if any antibody, that is anti-A or anti-B, if it is present at birth, for example, you saw that anti-A and anti-B is present at birth, then this antibody, it is of maternal origin. And since it has crossed the placenta, therefore it is of IgG nature. Okay, remember this. But remember, whatever naturally occurring antibody that we are going to see in the body, any kind of naturally occurring antibodies that we see, that is anti-A and anti-B. Okay, remember this naturally occurring antibody is always of IgM class, always of IgM class. And because this IgM has a valency that can bind with 10 antigens at a time, so always they cause visible agglutination. That is, whenever agglutination occurs, when you do the blood grouping, you can, with your naked eyes, you can see the agglutination which is taking place. Okay, and remember, these IgM, they can fix the complements. That means they can lead to what is called as intravascular hemolysis. That is why whenever there is a hematologic blood transfusion reaction, in that situation, you are going to see that there is intravascular hemolysis, because it is happening due to the presence of IgM antibodies. Okay, so this naturally occurring IgM antibody is responsible for the ABO mismatch blood transfusion reaction. Also, it is responsible for graft rejection in case of solid organ transplant, or in case of bone marrow transplant as well. They are responsible for graft rejection. So if an ABO mismatching is there, then all these reactions are going to occur. Okay, now remember, the naturally occurring antibodies, they are always of IgM nature. Okay, now remember, if these anti-A and anti-B antibodies, suppose they are not naturally occurring, they have been induced. How they can be induced? So for example, this is a group A individual. Okay, and to this individual, group A individual, you gave B blood group blood. In that case, what is going to happen? Okay, not like this. Okay, just wait 1 second. I'm going to tell you what is going to happen. There will be hemolysis of this B. Okay, so any kind of antigen, if it is not present, and if you introduce that antigen antibody, then the antibody will be produced for that particular antigen. Just let me make this point clear to you all. Okay, it will become very clear to you all. Okay, just listen to me carefully. So inducible antibody, they are of IgG class. Any kind of inducible antibody can be of IgG class. Okay, so for example, group O individual is there. Okay, that group O individual, basically, for example, he is having very low amount of anti-A or anti-B antibody. Okay, so for example, if that individual is given an A or a B blood group, for example, then that individual, okay, although they are having less amount of anti-A or anti-B, if you give A or B blood group to this group O individual, they can synthesize in excessive amounts the amount of anti-A and anti-B. And this anti-A, anti-B, which is basically formed in increased amounts, okay, they are of IgG class. So any antibody which is naturally occurring will be IgM class, whereas any antibody which is inducible, that is your IgG class of antibody. Okay, this IgG class can cross the placenta and can cause hemolytic disease of the newborn. Now how do this individual will have? See, I am not denying the fact that group O individuals, they are already having anti-A as well as anti-B. This is already present in the plasma of these individuals. Now, for example, that individual has got some kind of blood transfusion. Okay, for example, he got A or B, any kind, or he got some vaccination, some injection, antibiotic, anything. Something had stimulated. So in addition to the naturally occurring IgM antibody, this individual synthesized excessive amount, more amount of anti-A and more amount of anti-B was synthesized by this individual. And this excess amount that was synthesized was of IgG class. And this can cross the placenta and cause hemolytic disease of the newborn. Is this term very clear to everyone? What is inducible and what is naturally occurring antibody? Yes. Any doubts with regard to this? Okay.
No, sir.
Now that is why remember this group O. See, group O is always regarded as a universal blood donor. Okay, we always say, but it is an oversimplification. Always remember. Okay, such individuals of group O individuals which contains excessive amount of inducible antibodies, they are very dangerous universal donor. Okay, they can cause recipient RBC hemolysis. Okay, now always remember one thing. Whenever we are giving a blood transfusion, okay, we always regard the recipient's plasma and the donor's red cell. So suppose if I am giving one packet of blood, for example, if I am giving, okay, for example, I am giving A to this recipient who is also A. So basically the donor red cells are containing A antigen, but the donor plasma is also there. Some small amount of donor plasma might also be present over there. And that donor plasma will also contain some amount of anti-B, okay, or some corresponding. So remember, there is always some reaction between the donor's plasma as well as the recipient cells also. Always remember this aspect. So for example, if the donor I am taking, that O blood group, is a universal donor. Okay, why we are taking it as a donor? Because over here we will just consider the donor's red cell status. So over here no antigen is present in the blood group O, and we are giving to some individual. For example, the individual is A blood group, okay, or the individual is B blood group. So because they might have anti-A or anti-B, but over here since no antigen is present, so as a result there is no reaction whatsoever. Okay, so always remember this particular aspect of the individual. Now always remember one thing. You will always argue that, sir, for example, okay, the individual that is there, he is of AB type. Okay, for example, if I'm giving the blood to an individual who is AB type. Okay, so in such individuals, both A and B antigen is present. Yes or no? Now, donor's red cell, okay, donor's red cell might not contain any antigen, but the donor plasma is containing anti-A and anti-B if this is O and this is AB. Yes or no? So AB antigen is there, but there is, just wait one second. Over here, AB antigen is absent, but anti-A and anti-B is present in the plasma of the group O individual. So that can interact with the AB of the recipient. So remember, because the amount of blood that we are giving from the donor is very less, this reaction is very, very less, and we have to ignore. So whenever we are doing the grouping, the most important thing in grouping to consider is the fact that we will always consider the donor's red cell. That is, we are always going to consider the donor's antigen and the recipient's antibody. This is what I wanted to tell you. Always the donor's antigen should be considered and the recipient's antibody. So in that strict sense, if you ask me, blood group O becomes the universal donor, whereas the AB blood group becomes universal recipient. Is this very clear? And to be much more specific, if we are also taking into account the RH blood group, the O negative individual becomes universal donor and AB positive individual becomes universal recipient. Is this crystal clear to everyone? Yes. Okay. Now we have understood about the ABO blood system. We are now going to understand the RH system. So as we had seen, the AB genes were present in chromosome number 9. So over here, this gene is present, that is the RH gene is present in chromosome number 1. So over here, the RH locus is present, and that contains two very closely related genes, that is the RHD and the RHCE gene. So the RHD gene, okay, it is encoding for the D antigen. And if a person is positive for this D antigen, he becomes RH positive. And if he is negative for this D antigen, he becomes RH negative. Luckily, 95% of the population is RH positive, whereas 5% of the population is RH negative. And similarly, this RHCE is also encoding certain genes like capital C, capital E, small e. These are all alleles. Okay, these are also different antigens, but they are not that important, because these antigens are not that much immunogenic, whereas the D antigen is highly immunogenic. So that is why clinically this D antigen became more relevant. Okay, So remember, if you give an Rh positive blood to an Rh negative blood, okay, so that is going to induce formation of anti-D antibodies. Okay, so this Rh antigen is also present on the surface of the RBC. Okay, and all positive individuals are having this Rh antigen. So if you give the donor, so always remember, whenever we are giving the blood, the donor's antigen is considered. For example, you are giving blood, O positive blood is given to an O negative blood. What is going to happen? This is containing the this is containing the antigen. So what will happen? If you give it over here, this individual is going to synthesize an antibody, that is anti-D antibody. Okay, that is why we do not regard O as a universal donor. We say O negative as an universal donor. So O negative can give blood to O positive without any risk, but O positive cannot do the same thing. Is this very clear to everyone, the concept of RH? So the concept of RH, as I told you, if you give, for example, A positive blood, you are giving to A negative individual, or B positive, you are giving to B negative. Any positive you are giving to any negative of the same group, it is going to lead to hemolytic transfusion reaction. And also this is the one which is responsible for the RH hemolytic disease of the newborn. So always remember, whenever you are saying hemolytic disease of newborn, there are two types. One is ABO type, one is RH type. Okay, so always remember this thing. Okay, over here, the mother's blood, okay, is Rh negative, the child is Rh positive, and the child blood, if it enters the mother, okay, it is going to synthesize the antibodies against the child. Now the first pregnancy, nothing will happen. In the first pregnancy, only sensitization will be there. In the second pregnancy, if you see, the problem is going to arise. Okay, okay. Now this RS system was independently discovered by two group of scientists. One was Stetson and Levine, and another was Landsteiner and Weiner. So this was in 1939 and this was in 1940. Okay. Now there was a nomenclature system. Now this is the current nomenclature system that we have already read about. Okay. You are going to write this when you're asked about the RS system. But if, for example, in MCQs, they can ask you what were the other classification systems in place. So there was one classification system called as the Fisher-Race system, and there was another classification called as the Weiner system. Okay. Now remember one thing, there is very less point of difference. Both of them theory says the same thing, that in the chromosome number 1, in the short arm of chromosome number 1, the Fisher system is saying that the three closely related genes, that is D, E, and C, these genes, okay, they are inherited together, one from each parent. For example, this is from the mother, this is from the father. Okay, so this is so these are three closely related genes which are inherited from each parent. Okay, and they are then responsible for the different kinds of alleles and the different antigens. Whereas the Weiner system, what they said, that instead of three different genes, a single gene like R1 and R2. So for example, R1 is from the mother and R2 is from the father. Okay, so a single gene is inherited, and this single gene has multiple alleles. Okay, so for example, R1 corresponding to capital C, capital D, small e, whereas R2 is corresponding to small c, small d, capital E. Okay, so just these are the different alleles. So both systems are talking about the same thing, but just in a different manner. So over here, single genes encodes multiple alleles, and each of these is inherited from either of the parents. Now, what is very important, just like the ABO system, the RH group is also expressed on the surface of the RBC. But what is the very important point? Unlike the ABO antigens which were present in the other body tissues, these are not present in other tissues. So this you have to consider, very important. The RH antigens are only present in the RBCs and not anywhere else. It is not secreted in any kind of fluid. Okay. And unlike the ABO antigens, okay, which takes approximately 2 to 4 years to fully develop, these antigens, they are fully expressed before birth, even in early fetuses they are expressed. Is it very clear to everyone? Okay. Now there is one concept regarding this RH that is called as the concept of weak D antigen. Very, very important. Okay. So what is this concept? Let me tell you. Some RBCs, okay, so this is an RBC over here. So as I told you, there is presence of H in all. Similarly, if those who are positive, they have RH positivity. So for example, if this is there, then what is the blood group of this individual? Yes, can anyone tell me? What is the blood group of this individual over here? Kya hoga? What will be? This will be A and positive. So when you're writing A positive, there are two groups of systems that you are talking about. One is the ABO, one is the RH. Okay. Now, in some individuals, this RH, okay, it becomes very, very weak. Okay, it becomes very weak. So in that situation, when we carry out agglutination, this will come out to be A negative. A negative. So such individuals with a weak D antigen, such RBCs with weak D antigen, they are called as dew cell. Okay, there is a quantitative reduction in the amount of D antigen. So do we label these individuals as A negative? No, that is why
No.
there is a law. Any kind of blood group that is coming out to be negative, for example, A negative, O negative, B negative, AB negative, you always carry out one test that is called as a dew test. It is an indirect test, indirect variety of Coombs test. I'm not going to details of how the test is performed, but you should always carry out a dew test for these individuals. Okay, always remember this thing. So remember, in the Dew's test, this test is going to come out as positive. Okay, and remember, individuals with this reduced amount of D antigen, they are regarded as positive only. Remember, always remember, so the individuals who are the donors or the Dew donors, individuals having weak antigen, are always considered to be as RH positive, and they should never be given to any other individual with RH negative. Did you understand this concept? Now, for example, over here, I did the slide grouping method, and this was a weak, and I give this and I have given this as A negative. Now, for example, if this goes out, okay, and if, for example, we have not done the due test, and if this A negative is given to, for example, by mistake, it is given to another negative person, thinking that this is a negative group. Now, they do not know that RH is weak, so that is going to cause immunization in the other individual. Now, is this concept very clear, the concept of weak D antigen?
Sir, can you repeat this one once?
Yes, I will just repeat it. It is no problem. I'm just telling you one thing. Just first you answer my question. If, for example, an individual is having this blood group that I have shown you over here, then what do you think is the blood group of this individual? It is A positive, because the RH antigen is present. So we call it as A positive. Now, sometimes what happens is this RH antigen becomes very weak. So the normal agglutination test that we carry out, the slide method, the tube method, it might show negative staining. It might show that it is a negative. Okay, there is no agglutination with the RH because the antigens are very weak. But to confirm this, so that is why we might label it as A negative. But A negative or any kind of negative blood group should not be labeled just by doing a single test. To confirm the negative nature, we have to carry an indirect Coombs test that is called as dew test. Okay, we have to carry this dew test, and this dew test will confirm the presence of the weak antigen, and now the patient will be labeled as A positive only. So any individual, okay, who is having presence of dew cells or weak D antigen, if they are considered as a donor, then they should always be considered as a positive donor. That is, they should always be considered A positive or B positive or AB positive, or whatever be the group, they should always be considered to be as positive. Okay, so the basic funda over here is that in the slide grouping method, if you see, if it comes out to be RH negative, any method, you test for the weak D antigen, that is the Dew's test, that is the indirect Coombs test. If this test is also coming out to be negative, only then you can label the individual as RH negative. Just remember this concept of weak D antigen and the Dew test. Is this very clear to everyone? Yes. Okay.
Yes, sir.
Now, about the RH antibody, as I told you, this RH antibody is not a naturally occurring antibody. Okay, it is never present. Okay, it can only be present if you give a positive blood to a negative patient. And in that case, this will be inducible because it is never naturally occurring. So this is always inducible form. So it is always of the IgG class and it can cross the placenta. Okay, remember, it is inducible variety. Okay, it occurs with pregnancy or with transfusion. So if a Rh negative mother becomes pregnant with a Rh positive fetus, so it can induce the Rh positive blood of the fetus can go into the mother and can induce the formation of anti-D. So that is why it is an inducible antibody, and any inducible antibody will be of IgG nature only. One very important point of difference from the ABO blood grouping is that over here there is no complement activation, so you are only going to have extravascular hemolysis. So remember, if you are giving, okay, an A positive blood to an A negative individual, or a B positive to a B negative. So if there is just a mismatch with the RH, there will not be intravascular hemolysis. There will only be extravascular hemolysis. Remember this point. Okay. Now we are going to start with the grouping. Now grouping is very easy, not very difficult to understand. If you have understood till here, we will do the grouping now. Very, very interesting. Now I will show you multiple images, multiple new technologies that has come up. So it will be very, very interesting. Now this ABO blood grouping that is there, it is of two main types. One is the forward or the cell grouping. Another is your serum or the reverse grouping. So the forward grouping is also called as the cell grouping. So over here, my target is to test for the presence of antigens on the surface of the red cells. So the red cells are tested for the presence of A or B antigen. So forward grouping means I am testing for the presence of antigens on the surface of the RBC. That's it. And over here, how do we test? We are going to use a company made or manufactured antibody. So I am already having some antibody or anti-sera which is prepared. I am going to show you. This is what is called as forward grouping or cell grouping. Another type of grouping is called as a reverse grouping or serum grouping. When I'm saying serum, I told you first, serum means I want to test for the antibodies. So the serum is tested for the presence of anti-A or anti-B antibodies using some known reagents. Okay, so we are using known A reagent, RBC coated with A antigen, or B reagent, and then we are testing. So this is from the company, okay, or manufactured. Okay, so you have understood, in one test we are checking for the antigen, and other test we are checking for the antibody. Now remember one thing, as I told you, ABO blood grouping of the cord blood and infants less than 4 months require only cell grouping. I told you about this concept. Why? Because the antibodies are not detectable in the newborn. Only in after 3 to 6 months of time that the antibodies will be present in the plasma of the child. Okay, remember, only forward grouping is done below 4 months of age, or even below 6 months of age. Only forward grouping is done. Reverse grouping is not done. Why? Because antibodies are not present in the plasma of the infant. Is this very clear to everyone? Okay, now we are going to see the blood grouping methods. So the first grouping method is the slide method. Then we are having the tube method, microplate method, gel or column technology method, and then we are having solid phase adherence technology. Now remember, the two methods that you must have seen is, one is the slide method and one is the tube method. But remember, these are very, very old methods. Just for demonstration to the students, we are doing these methods. Even in the lab that I'm working, they are doing this because we are working in resource poor lab, in a resource poor area. So because of that, we have to work. But in all the tertiary hospitals, they are carrying out the gel or column technology, microplate method. These are very much advanced, even solid phase adherence technology. Okay. So let me just show you the slide method. In the slide method, what I am doing, okay, so I have taken a drop of blood over here, and this is the forward grouping that I am talking about. So I have taken a drop of blood. This is taken from the patient. To that, I have added a drop of anti-A, and this is company manufactured. Okay, anti-A reagent I have given, and over here anti-B I have given. Then I have added the drop of blood. I should give around 2 minutes of time, and I should mix this entire mixture, giving 2 minutes of time, and then I should check if any agglutination is present. So presence of agglutination of the RBC indicates the presence of that particular corresponding antigen. So let me show you this particular diagram. Can you appreciate there is a universal color coding? Now here, this is anti-A containing anti-A antibodies. Okay, this is your anti-B, which is containing your B. Okay, then comes your anti-AB. This is your anti-AB. It is going to lies both A and B. And this is your anti-D, which is for RH grouping. Okay, so both anti-D as well as anti-AB, both of these are colorless. Anti-B will be yellow in color and anti-A is going to be blue in color. So the color coding is very clear to everyone. There should not be any difference. Okay, now very important, the preservative that we are using over here is sodium azide. And these reagents, I'm talking about these reagents, they should be stored in the lower compartment of the fridge, and the temperature should be maintained between 4 to 6 degrees Celsius. Okay, remember they can be produced polyclonally or they might be monoclonally produced. More commonly, we use the monoclonal variety. So let me show you the interpretation. Now, for example, over here, the agglutination was just seen with anti-A. So the blood group will become A. Okay. So over here, the agglutination was seen just with B. So it is called as blood group B. Over here, agglutination was present in both A as well as B. So you will see AB. Whereas over here, neither here agglutination was there. So the blood group will become O. Always remember one important aspect: whenever agglutination occurs, the color of this entire sample will become that of that group. It will become bluish. Over here also it will show yellowish. Okay, just remember this aspect. So now if you have understood this slide method, tell me what is this blood group that we are seeing over here. Yes, this is how the slide test is done. Can you tell me what is the blood group?
B positive.
B positive. Yes, anyone else?
O positive.
Someone is saying O positive. Anyone
Positive.
else? Yes?
O positive.
O positive. Okay. Is this color looking like red? Is this color looking like red like this? Yes? Is this color looking red like this? Tell me. No, this is
AB
AB positive. This is AB positive. See over here, as I told you, this entire thing has formed a clot. This entire thing has formed a clot. This is A positive, this is B positive, and this is RH. Okay, so RH has also been done. So this is AB positive blood group. I told you when the clotting will occur, you will be able to see the color exactly as it is. If the clotting will not be done, then you will see only red color. Wait, after the class, I'm going to give one very beautiful diagrams in the group, so you will be able to understand everything. Okay. Now, regarding the slide method, the important thing is that very importantly, this is very quick and simple. So if you are carrying out a blood bank camp, if you are organizing a camp, if there's an emergency situation, this can be done. Okay. One very bad thing is that once the sample is going to dry, so sometimes even if it is negative group, okay, you might say it as positive because the clot will form after some time, and that clot can be mistaken for agglutination. So it dries quickly. So you have to see the slides very quickly. And also very important, it fails to detect the V antigen. Okay, it fails to detect the weak antigen. And as a result, okay, if it is any kind of negative group, if we want to confirm, we have to go for the due. Okay, we have to go for the due. And if, for example, if I'm not sure about whether it is A or B, if there's a discrepancy, for example, the first time you perform the test, it came out to be A positive. In the second time you perform the test, it came out to be B positive. So whenever discrepancy is there with the AB, then you go for reverse grouping. Okay, you check for the antibody. Okay. Okay. And lastly, this method is not confirmatory. You should always confirm it with the tube method. Okay, you should confirm it with the tube method. Coming to the next method, that is the tube method. If we see, it is far more reliable. The tube method of testing is far more reliable, but it takes little bit more time. So in the tube method, what we are doing, see, in all of them, we are doing forward grouping only. We are trying to see the antigens which are present on the RBC surface. So the saline washed RBC of the patient, this is taken from the patient sample is taken in a tube, and over there we have taken a known anti-sera which is from the company. Okay, which is from the company or which is manufactured. Okay, then you incubate over here at room temperature 37 degree, followed by centrifugation. So the idea of centrifugation is to make the test more sensitive. When the centrifugation will occur, the antigen and the antibody are going to come very, very close with each other. And as a result, what is going to happen? Okay, after you centrifuge, at the end, if you take out, you will see a red bottom is formed. Okay, at the end, you will see that a red bottom is formed. Okay, like this. Okay, and this is the sample basically. So red button is formed. So what you have to do mechanically, you have to shake it. So if you see any clumps, okay, then the test is positive. If you see no clumps, then the test is negative. Let me show you the interpretation. Now, for example, the sample is diffusely present like this. If it is like this, it becomes negative. If, for example, small clumps are present, as we can see in this diagram, it is grade 1. It is means positive. All from grade 1 to grade 4, they are positive, but there is a gradation. Okay, if, for example, larger clumps are there, it is grade 2. If 3 to 4 large clumps are there, it becomes grade 3. And if one large clump is present, it is called as grade 4. So is this very clear to everyone how the gradation is done for the tube method? Now, if you compare with the slide method, if you see, this method is far more reliable comparing with the slide method, because they can detect weak antigens also, because it is a sensitive test. Again, over here, because everything is in the liquid state, so there will be no drying and clot formation. So for example, like for me, I will tell you, sometimes that I am over sometimes, for example, if I cannot attend my laboratory, so the technologist in the laboratory, what he does, he performs the blood grouping by the tube method, and he just keeps it. He does it in the morning. And when I go at night, okay, when I go to the lab at night, I just check it, because it is liquid form. So nothing is going to happen, and I can check the grouping at any point of time. Okay. And very important, it saves on the reagent. Very less amount of reagent is required for this particular test. Now, for all the above method that we are doing, we have to have certain control. Usually in very big setups, in tertiary colleges, in good hospitals, they have this control, because this is part of quality control. So you should have an auto control. Auto control means that you should take the patient sample and you should just keep it for 5 minutes or 6 minutes, like that, in an EDTA anticoagulated while you should take the sample. Sometimes what happens, that the patient's own plasma is containing certain cold antibodies or auto antibodies is there, and that causes agglutination. So patient's own antibody is causing agglutination. Okay. So basically what you are going to see, that whenever a patient is AB plus RH positive, even cross match is coming out to be positive, even antibody screen is coming out to be positive. When you see that everything is coming out to be positive, you suspect that there is some problem. The patient's own antibody is causing agglutination. Okay, so we do this auto control to rule the presence of any cold auto antibodies present in the patient. Then we carry out a positive control and a negative control. Positive control means I will have a control which is showing agglutination. That means I want to compare that agglutination looks like this. A positive test looks like this, and a negative test is completely blank like this. Okay, so we do the positive control. For example, you take the anti-A sera, you mix it with the group A RBC. So you made a positive control. Negative, for example, you just reverse it. You take anti-A sera, but you add group B RBC. So here there should not be any agglutination. Here there should be agglutination. So this is the positive control, this is the negative control, just to compare how agglutination looks like. If you get a result like this, that means it is positive. If you get a result like this, that means it is negative. Okay. And auto control. The auto control should also do not show anything. Okay. This is auto control should be like this. So 3 types of control we use while performing blood grouping. Important exam question. Okay. Should be able to answer. Okay. The next method is called as the microplate method. Now, the microplate method basically makes use of 96 microvels. Can you see this very small wells? Yes, everyone. So there is 12 into 12 into 8, that is 96 wells are present over here. So over here, what happens if you, what you are doing to this, each micro well, you are adding RBC. Okay, and we are checking for the antigen, that we are doing the forward grouping. And this anti-sera, this is taken from the company. Okay, this is taken from the company, and this RBC is taken from the patient. They are added to the microvell, and then this microvell is centrifuged. Okay, incubated at 37 degree, then centrifuged. Then red cell button is formed at the bottom. At the bottom, some button will be formed, and you should shake it vigorously, shake it manually. Now, after shaking, if a solid concentrated red cell button is there, it is taken as a positive agglutination, like this. If a button is formed like this, this is taken as a positive. Okay, so let me just show you the grouping, how it is there. So on the, if I show you on the y-axis, if you see, we are having the reagents. Okay, on the y-axis, I have taken the reagents, and on the x-axis, this is the patient identification. This is patient 1, patient 2, 3. So for example, patient 1 with anti-A, okay, it has shown. So it is A. Okay, anti-B did not show. So it is not. Anti-AB, again, it is showing A. So again, with this that we are done, this is called as the forward grouping. Okay, and this that we are doing, this is the reverse grouping. And then with this is the RH grouping. Okay, and this is the auto control, came out to be negative. So this individual, if you see from here, he is A positive, RH is positive, so he is A positive. Over here, they are showing agglutination with the B cells, because A blood group, they are containing anti-B. So in the reverse grouping, we are checking for the antibodies of the patient. So that is reacting with the B. So this is coming out to be A positive. Similarly, if you see over here, everything is the same, but RH is not there. So it is A negative. Now you understood how this microplate technology is working. Very important thing about the microplate technology, it is very sensitive, highly reliable, and it is suitable for automation. So you can use this method in automated devices. Is this very clear to everyone? Now, what is very important, especially for the postgraduate students, this gel or column agglutination technology, very important short note that is asked, and in all big colleges, this is the technology that is being used in blood banks. It is not from today, it is from the past 5 to 7 years they are using this gel and column technology. So first, let me show you what is this. So basically a card is available. Can you see this card, everyone? This is called as the gel card, which is available. And today, maximum blood grouping in the big hospitals, they're carrying out by this gel card technology. So over here, we are having 6 microtubes, as you can see, 1, 2, 3, 4, 5, 6. There are actually 6. Over here, you can see there is 6 tubes. Okay, over here, they have shown 5, but there are 6 tubes. And this tube, it is containing a gel, which is a medium that is made up of dextran acrylamide gel is present over here. Now, this gel is actually acting as a reaction medium where the reaction will take place. Plus also as a size filter, it is acting as a size filter. Means different size particles are going to accumulate at different levels. So see over here, particles accumulated at this level, particles accumulated at this level, particle accumulated at this level, particle accumulated at this level. Okay, so over here, what we are doing, this gel is containing this gel, that is acrylamide gel is there. Along with that, the anti-sera is there. This is provided by the company. This is provided by the company. Now to this, we are adding the patient's RBC. Patient's RBC are added over here. Now, for example, if agglutination is occurring at the top, okay, if it is occurring at the top, it is taken to be as positive. And if agglutination is taking place at the bottom like this, it is said to be negative. Now, from here, there's a different gradation. Now, for example, some of went little bit up. It is also positive, but it is 1+ positive. Some of this went little bit more up. It is 2+ positive. Some of them stayed here. It is 3+ positive. Some of them stayed at complete top. That is 4+ positive. So this is over here, even the gradation is there. Now, this test is quite expensive. It is standardized, sensitive, and also suitable for automation. So this is the gel card technology if I show you. Now, what is this test? Yes. What will this be? Yes.
Negative.
This no, this is at the bottom. If it is there, it comes out to be negative. At the bottom is negative. This is the control. If you see, this is the control. This is the control, negative control that has been shown. Okay, over here, if you see, they are testing for A and they are testing for B. Now, if you see, both of them are formed at the top. So if it is formed at the top, it is taken as positive. So it is A positive, B positive. The gradation of B positive is 4+. The gradation of A positive is taken as 3+. Okay. Is this clear to everyone? As you go up, the test will, so agglutination at the top is considered as positive, at the bottom is taken as negative, and I've also showed you the gradation that you should understand. Okay, clear to everyone? Can we move ahead? Now, this is the last, that is the solid phase adherence technology. Now, I am telling you, at least you should remember till this point. If you don't want to remember about solid phase adherence technology, is all right, because this is not very recent. Maybe in first world countries, they are using this solid phase adherence technology, but it is not very commonly carried out in our country. So even if you want to skip this, you can skip, but I'm yet telling you. This is also a method which is based on the microvell. Okay. So if you see, this is one microvell. Okay. Like I showed you the microvells over here. This method is also making use of microvells like this. One microplate like this is there. So in one of the wells, I'm telling you what is happening. Over here, a company provided reagent red cells are there in the bottom. The serum sample is taken from the patient. Now, in all the tests that I have performed till now, that I have shown you, we are doing the forward grouping. We are just taking the patient's RBC. This is the only test where I am taking the serum sample of the patient. Okay. So this is basically done by a reverse method. Okay. It is a reverse grouping method that we are doing over here. So the patient serum sample, that is, I'm checking for the antibodies in the patient. This is taken, and on top of that, indicator RBC is attached over here. Okay, on top of that. Now, for example, only and only if the patient's serum sample containing the corresponding antibody is going to bind with this reagent red cell, only then the indicator RBC is going to combine with this antibody. Okay, and the diffuse adherence of these RBCs are taken as a positive test. Diffuse adherence of the RBC is taken as a positive test. So see, if a solid button is formed like this, okay, this test over here was taken as a positive. If you see over here, this was taken as positive. But if you see over here, it is completely opposite. Something like that formed over here is taken as negative. And diffuse adherence, if you see just a reddish, if you see diffuse adherence, if you see, can you appreciate diffuse adherence? There is a diffuse, if it is spreading, if it is a spreading diffuse adherence, it is taken as positive. If you want to remember this, you remember. If you don't want to remember, you leave it. Okay, I don't expect you to remember so much. This is a very expensive, standard and a sensitive test, and it is suitable for automation. Okay, is this clear to everyone? All the methods that I have discussed, it is very easy. It is very, conceptual. Okay, very easy, very conceptual, all these methods. Now, coming now to the problems with the grouping, normal grouping, as I told you, if, for example, the patient's own plasma is containing autoantibodies, so at own temperature, it is going to agglutinate its own RBC. So basically over here, all the tests will be positive. The patient will always come out to be AB positive. Cross matching will be positive, antibody screen will also be positive, everything will be positive. So in such individuals, you should always carry out an auto control. Means before adding any reagent, just wait for 5 minutes and see whether the patient's own sample is clotting on its own. Okay, so what is the basic thing over here? You wash the RBCs with warm saline, okay, and then repeat the test. This is auto agglutination, the first problem. Second, the problem of weak antigens, I told you. If any weak antigen is there, it will give a negative test. So weak antigen in case of AB, if there's a discrepancy, you go for reverse grouping. So for example, in one sample, it is showing A positive, and another sample, it is showing O positive. Means A is not, it is not cutting or agglutinating. So in that case, it might be a weak A antigen. So you have to do a reverse grouping to confirm, okay, whether it is A positive or not. Now, for example, in the in the RH system, if you see, as I already told you, in the RH system, if it comes out to be negative in the RH system, so in that particular case, what are you going to do? You are going to confirm by doing a due test. Only if the due comes out to be negative, that you are going to label. So over here, you carry out more sensitive test. Okay, you can do the reverse grouping or you can do the due test. I've already discussed this. Sometimes in conditions of multiple myeloma or where there is excessive amount of antibodies in the plasma, okay, in that situation, what will happen? RBCs adhere to each other, leading to what is called as Rouleau formation. RBCs adhere like stack of coin. And this is classically present in case of multiple myeloma plasma cell disorders. So in that situation, you should be able to differentiate between the Rouleau formation and the agglutination. How do you differentiate? If you add normal saline, that will disperse the Rouleau formation, but it will not be able to disperse the agglutination. This is how we differentiate. And lastly, sometimes we are given with the cord blood. So cord blood might contain Wattson's jelly, which itself might cause agglutination. So the basic treatment for that is always you wash the cord blood and then you carry out, okay? So these are some of the important problems with the grouping, okay? So the common problems that we face with grouping. Now about the RH grouping, if we see, RH grouping is always done along with the ABO grouping. You should always carry RH grouping along with the ABO grouping, remember, okay? Now, in case of RH grouping, remember one thing, that any person that is coming out to be RH positive, okay, that doesn't have the corresponding antibody, and even the RH negative individual, they don't have anti-D. So both RH positive and RH negative, they do not have any kind of anti-D. This is not present. So what is very important over here in this individual, that reverse grouping or serum grouping is not applicable in case of RH. There is just RH forward grouping. We are just checking for the presence of RH antigen. That's it. Okay. Remember, if RH comes out to be negative, I told you, you have to rule out the weak B. So you have to carry out due test. This is the last column that we are going to see. The basic difference between them. ABO grouping is A, B, AB, and O, and RH is given as positive, negative. Forward grouping is available for both, whereas reverse grouping is only available for ABO, not for RH. The anti-sera that we are using to carry out the ABO grouping is containing IgM. Over here, we use either IgG or IgM. And the color coding, if you see, A is blue, B is yellow, AB is colorless. Whereas again, over here, the RH grouping is also colorless in nature. So with this, we have completed this entire blood grouping systems along with the blood grouping methods and with the complications as well.